Okay, hi, there's Dr. Buford. We're just getting started on the right shoulder. We've already confirmed that the biceps is torn, and then just to the left and above, the rotator cuff's torn also. So we're going to get right to work here. We're going to put this suture around the biceps and push a little bit more of the suture in. Biceps. Push in a little bit. And we may not push. I can't see the left. Okay, so we'll push the suture in straight in here. See if that helps us. We'll get this in and show you what it looks like in just a second. Here you can see we've got a suture going around the torn biceps. Next we're going to take a spinal needle and pass it through what we can here. So that's one pass. Yep, so that's one pass. We'll take our super shuttle, pass it through the wire. And then here we're going to reach in and retrieve it. Same thing one more time. Pause, please. Okay, so we've got the suture passed around the biceps, and this is just our attempt to prevent it from releasing too far. So we call this a soft tissue tenodesis. Okay, and next we'll put in our shaver. And we'll get to work on smoothing out some of the rough areas that are left behind here. Have a look down the front of the shoulder. And then we'll rotate and have a look towards the back of the shoulder. And this anatomy looks pretty good, so I think the next thing we're really going to have to focus on is the rotator cuff. We'll go off on the video and show you some more in just a little bit. We're taking that from. Okay, so here's the tear in the tendon. Here's the edges of it. This is the posterior edge right here. And then we can see around to the front. Your biceps tendons over here, we have that on hold basically. But we're going to put a suture anchor down right here and try and get this tendon anchored back down to the bone. So we're going to make a little nick in the skin, and then we're going to make a little starter hole in the bone with a punch. So there's the punch. There's the articular surface of the joint, or of the humeral head rather, and as you see, we just tap down and make a little hole in the bone right here. Next we'll take our metal suture anchor down and we'll place it in the hole we just made like that. Take it down all the way. There's a black line that we want to place underneath the bone surface, just about like that. And next we'll undo the screwdriver. And that gives you 3 different sutures to work with. Pause, please. Okay, so here's our sutures. On the articular side, we can see there's a blue suture, then a black one, then a white one. We're going to start from left to right, which means we're going to reach in here and take the blue suture first, just like that. And then we're going to work from the left side of the screen with our suture hook. So here it is coming in. It's loaded with a black wire called the super shuttle. You can see it right there. And then we're going to use this instrument. It's a little bright, so maybe you can turn it down a little 15. Can't tell. There you go. There you go. That's 110. That's fine. Okay, so when we lift up the cuff, notice here we've got some split tears in it, so we want to reach in here and make sure we get the deep layer of this cuff. Which I just have a hold of it there like that. And now I can make sure I get through that deep layer. So we'll go ahead and feed the wire, which is also the same thing as the super shuttle. And then outside your shoulder, we're going to load it with that blue and white striped suture. And then as we pull back, it's going to bring that suture through and through. We'll go ahead and reach in and get the partner stitch. And we also want to take the black one at this point too. And then we'll take the other limb of the black suture out to the right, just like that. So now we're set up for the second stitch. So here's our hook. Check underneath here. Okay, we're all done here. Everything looks good. So here's the finished repair. The rotator cuff tear used to be right there. You can see the sutures holding everything together. And you can see the bicep suture over there to the right. So I'm real happy with the way that looks. We'll have to hope this has a lot of good blood flow and a good blood supply to heal. And we'll get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye.